Today there are 18,311 active cases of COVID-19 in Alberta. That's an increase from yesterday of 1,021 on 14,199 tests that were completed, which represents a positivity rate on those tests of 7.2%. 802 Albertans are in hospital because of COVID-19, of whom 152 are receiving intensive care. Sadly, 11 more Albertans have passed away from this disease, meaning that 871 Albertans have lost their lives due to COVID-19 since the beginning of the pandemic. And of course, as always, our condolences go out to all of the loved ones and friends of those, particularly those most recently passed away. On behalf of all Albertans, I extend our deepest sympathy to those, to the family and friends of each and every one of those who've lost their lives to this virus all throughout the year. I am pleased to announce today that we've made some changes to the public health restrictions that will allow single Albertans to enjoy the holidays with loved ones in a safe way. Between December 23rd and December 28th, single Albertans may attend one event at another household. During that same time, households may host up to 2 single people for an event. This is a small change that was just adopted based on advice from the Minister of Health, with input from the Chief Medical Officer by the COVID Cabinet Committee, which just completed meeting. And it will make a world of difference for single Albertans who otherwise would not be able to visit their families over Christmas. I recall receiving an email from a constituent of mine in Calgary, Lougheed, who sadly lost his wife to cancer earlier this year. His son and daughter-in-law could visit him at home as a single individual, but he was unable to visit their children, his grandchildren, over Christmas. And this will be, I think, a meaningful opportunity for individuals in circumstances like that to have family support at Christmas time. Similarly, it will allow parents who would otherwise spend Christmas alone to welcome their children home for the holidays. Please know that the prohibition on large social gatherings remains over Christmas, and I regret that we could not make broader exemptions for holiday gatherings.
It's really important to remember that the individual days' variations in numbers are partly a function of how many tests are done in any given day. And so today I will note that our positivity remains at about 7%, which is not dissimilar to where we have been over the past few days. So again, of course, it's good news that our cases seem to have stabilized and are starting to come down, but we do need to watch all of those metrics, the new case, the positivity rate, as well as the R value, as we've talked about previously. So it's, from my perspective, I would say that the measures that were introduced in late November had an impact with respect to bringing our case numbers into a plateau. And when we layered on these additional restrictions that came into place, some of them came into place about 2 weeks ago, others about 10 days ago. We are starting to see again that layering on effect of these numbers starting to decline. However, we continue to have high case rates when compared to other provinces, and we need to stay the course. We need to make sure that these new measures put in place 10 days to 2 weeks ago get the full impact, that we are able to bring those numbers down so that we can lower the cases in hospital, as the Premier mentioned.
Remember, there is about a 10-day to 14-day lag on impact. So the most stringent restrictions that were announced that came into force 10 days ago, we will only begin to start to see the impact of that in the days to come. So what we saw was that the constant increase in the growth rate abated as a result of measures that were in place in November. I think that actually confirms the wisdom of our layered and gradual approach. Secondly, with respect to circuit breaker, the point I was making in that article is there is not a single jurisdiction that has had a successful 2-week short, sharp circuit breaker. And I think that we give people false hope if we suggest that there's a silver bullet out there, we just shut everything down for 14 days, we'd have a reset, we'd go back to very low numbers or close to zero. It just hasn't happened anywhere. Where people in my kind of position have pitched short, sharp circuit breakers for something like 2 weeks, inevitably they have gone on for months. And I'll give you the current example of the United Kingdom, where much of the UK went into what was advertised as a circuit breaker in October, and just this week they have expanded and deepened the restrictions to a stay-at-home hard lockdown in almost all parts of the United Kingdom. The Australian state of Victoria, in I think 5 months ago, went into what was supposed to be a short, sharp circuit breaker, and those extreme measures stayed in place for over 4 months with extreme costs for their society. So my point is, I've always said that if necessary, we will regrettably impose restrictions as a last and limited measure to preserve the capacity of our healthcare system and protect it from being overwhelmed. But we don't want to give people false hope that you can sort of solve the problem of the pandemic over 2 weeks. It just hasn't happened anywhere.